Surgery versus meds. Which is the better long-term solution? Watch to find out. How does weight loss surgery compare to some of the newer medications that are out for weight loss? There's a lot of publicity around the GLP-1 agonist medications. Those would be medications like semaglutides or Ozempic. And these medications work by stimulating a hormone called glucagon-like peptide receptors. In comparing medications versus surgery, surgery can have the same exact effects as the medication without taking the medication. In the long term, surgery is really the only real durable solution for permanent weight loss. Whenever we talk about weight loss, it's got to be a permanent solution. It cannot be just a temporary solution where you lose weight temporarily. Because if you lose weight temporarily, whatever is causing you to lose weight, if that stimulus is removed, more than likely with 99% certainty, the weight will come back on. Surgery is what we consider a long-term permanent solution so that the weight comes off and it should stay off permanently. The weight loss medications have their own list of side effects, and the weight loss that you would get with the weight loss medications are about half of what we'd expect in the long term for a weight loss surgery patient. We've done studies comparing surgery with the medications and found significantly more weight loss and longer-term weight loss with surgery versus the medications. We found that patients that are on the medications and stop the medications generally regain the weight after the medications have been stopped. And this is just like any other diet plan that we've ever done prior to these newer medicines, where if there's something causing weight loss, and we'll call it a diet, because I really don't like the term diet. Diet implies some kind of a change that's temporary. What I prefer is a lifestyle modification as a term. If we go on a diet, for example, well, the diet may work temporarily, but in the long term, habits return, lifestyle changes go back, and then the weight comes back on. And that's where surgery plays a role, is it doesn't allow those things to happen in general. When comparing long-term outcomes with surgery versus these medications, we find that there's a lot of side effects that people are encountering with the medications. And in fact, now I'm getting a wave of patients who have tried the medications that are coming to the surgery office saying they want surgery because they haven't tolerated the medications. These side effects would be things like abdominal pains, vomiting, diarrhea or constipation, pancreatitis. The medications work by a lot of times slowing your GI tract, and when they slow down your GI tract or your intestines, there's a lot of symptoms that come with that, such as pain, bloating, nausea. And these are things that patients can't endure over the long term, which is why these medications for some people may not be a good long-term solution for weight loss. So when comparing weight loss medications versus weight loss surgery, it does take me back to the set point theory. The set point theory basically says in your adult life, you have a current weight that your body wants to be at in your adult life. And that weight tends to shift up over time as you age and your metabolism decreases some. So when you go on a medication for weight loss, you don't really change a set point. You basically cause a stimulus in your body to decrease your appetite. So when you pull away that stimulus or you pull away that medication, your body doesn't forget where that set point is. And that's why your weight generally goes back up to where it was before that medicine was used. Surgery changes your anatomy, it changes your physiology. And so by doing that, you bring your set point to a new level, which is why the surgery should be more of a long-term solution. Because you've changed your physiology, and by doing so, your body now accepts a lower, what we call set point or average point, where your weight should fluctuate around. So follow for more weight loss tips and management questions.